So first we will learn modifiers. So what is a modifier, guys? So no need to worry. So modifiers are 2-digit codes. Usually we will append these modifier to CPT as well as AAPC codes. Okay. So these modifiers will provide additional information about the service or procedure performed. So these modifiers will inform the payer that there is a alteration in the procedure or circumstances. Okay. So basically these modifiers acts as a communication medium between healthcare provider as well as the payers. Here who is the healthcare provider? Physician. Okay. Physician who will provide the service comes under healthcare providers. And payers. So who is the payer? Insurance companies. Okay. So if the physician appends the modifier to CPT or AAPC code, it will provide some altered information about the procedure to payer. Okay. So why modifiers are important? So modifiers will provide accurate reimbursement. These modifiers will prevent denials. Okay. And it will prevent compliance issues, as well as these modifiers will justify the medical necessity as well as audit changes. So modifiers will reduce the audit changes. Okay. So if you don't use the correct modifier, so you will get claim denials, proper reimbursement if you use correctly. Okay. What happens if you don't use these modifiers correctly? Then it will give claim denials. If you don't use the modifier correctly, it will lead to claim denials and payment delays. So you will not get the payment within the duration of agreement between healthcare provider and payer. Sometimes if you don't use modifier correctly, it may lead to underpayment or overpayment. Okay. So underpayment means reduced amount. Overpayment means extra amount. Okay. In medical coding, underpayment or overpayment both are dangerous for the healthcare provider. Okay. So these are the information about modifiers. So these are very important for your interviews. Okay. So any doubt, guys, here? So what is a modifier?
Modifier will provide additional information to that particular CPT.
Yeah, perfect. So basically these will provide information or altered information about the procedure or service performed to the payer. These modifiers act as a communication between healthcare provider and payers. Okay. We have few modifiers, like most of the time in CPT we will use modifiers for bypassing NCC edits, which we will see soon. Okay. So we will use modifiers for payment adjustment. Okay. So we will use modifiers for medical necessity. Okay. For example, medical necessity. For example, your PDX will be left hip replacement. Okay. But for your CPT code, you have appended RT modifier like right hip replacement. Okay. So this is wrong, correct? So if we append left hip replacement as your diagnosis is left hip, for CPT also you need to append this LT modifier only. So if you append correct modifier, it will reduce the denials and you will ensure appropriate medical necessity. Okay. And also these modifiers provides compliance. Okay. So if you append correct modifier, you will follow to CMS guidelines as well as reducing the risk of fraud. Okay, and you will get rid of abuse investigations. So if you do the repeat mistake continuously, so CMS will audit your all cases. So it will consider you as a fraud. So you are doing the same mistake again and again. Okay, so those are the benefits of modifiers. Okay, so we have two types of modifiers. First one is CPT modifiers, which will be maintained by AMA. What is AMA, guys? What is AMA? Simple, American Medical Association. Okay, so American Medical Association will maintain CPT modifiers. So basically these modifiers are 2-digit numeric modifiers like 22, 25, 50, 59. All these are CPT modifiers. These are maintained by American Medical Association. Next one is HICPICS level 2 modifiers. These are maintained by CMS. Okay, so HICPICS 2 level modifiers will be maintained by CMS. So these are alphanumeric. So these modifiers contain both alphabet as well as number, like finger modifiers. If you take finger modifier, FA, F1, F2, F3, like that. So alphanumeric. These are maintained by CMS. Okay, and also based on reimbursement, we have three types of modifiers. Okay, pricing modifier, payment modifier, as well as informational modifier. Okay, so first we will see what is a pricing modifier. Okay, so basically pricing modifiers will increase the payment to the particular procedure. Okay, for example, if you use 22 modifier here, increased procedural services. Okay, this modifier will increase the payment to only that procedure, not to another procedure. Okay, and next we have payment modifiers. So for example, 59 modifier. Okay, so if you use 59 modifier, you are telling the payer that patient has performed multiple procedures during the same session. Okay, so that is the important thing you need to remember. Next one is informational modifiers. Okay, informational modifiers will not provide any payment information. So just they will provide information about the particular service or procedure, like laterality modifiers. Okay, whether it is left or right, they will not increase or reduce the payment. So just they will provide the information. So that's why those are the informational modifiers. Okay, so for example, if you go to interview, they will ask you what is the hierarchy of modifiers. Okay, or sequencing. How do you sequence if you have multiple modifiers? Okay, so you need to sequence modifier based on type of modifier. First, you need to use pricing modifier. So what is pricing modifier, guys? What is pricing modifier? Anyone?
Increase payment to the procedure.
Yeah, perfect. Perfect. Okay.
Vincent, can you spell that price in what is that particular name of the modifier?
Price, P-R-I-C-I-N-G.
P-R-I-C-I-N-G. Okay.
Yeah. Pricing modifier. Okay. Examples: 22, 26, 50, 52, 53, all those things we will learn soon. Okay. Next, you need to append payment modifiers. Okay. So these payment modifiers will alert the insurance provider like 24, 25, 51, 57, 58, 59, 76 and 78. We will see soon, no need to worry. Okay. Next, informational or locational modifiers like fingers, toes, coronary artery modifiers or eye modifiers. Okay. So what is the hierarchy, guys? What is the modifier hierarchy? First, what do you use? Pricing or payment?
First pricing, payment, then information, right?
Perfect. Yeah, pricing, payment and informational modifier. So pricing modifiers will increase the payment to the particular service or particular CPT code. Okay. So payment modifiers will provide payment to the multiple procedure if they are not bundled. Okay. Next, locational or informational. So they will provide information about that procedure. Okay. So that is the hierarchy. That is very, very important for interviews. Pricing first, payment second, and information or location later or last.
Can you repeat payment modifier?
So payment modifiers will increase the, payment modifiers bypass the bundling edits. Okay, for example, if you use 59 modifier, for example, okay, so you are telling the payer that in this encounter, physician has performed multiple procedure on the multiple anatomical areas or multiple incisions. So that's why I am appending 59 modifier in this situation. Okay. So payment modifiers will alert the insurance carrier or payer, stating that there is a special situation within this encounter. Okay. So that is the difference. Pricing, payment and locational modifiers. Okay. So now we will see our modifier examples. So you will get these modifiers in your CPT book. Okay. So these are the first page of your CPT book. Okay. So these are all modifiers. These are all modifiers. So we will see Appendix A for definitions. Okay. These are modifiers. Next we have category 2 modifiers. These are not needed for us. In surgery coding we will not use these category 2 modifiers. Next, anesthesia physical status modifiers. These are also we will not use. Okay. So next, these are very important. Modifiers approved for hospital outpatient use. Level 1 modifiers. CPT maintained by, who will maintain, guys? Level 1 modifiers. Who will maintain?
AMA.
Perfect. AMA. Okay. So who will maintain level 2 modifiers?
CM.
Perfect. CMS. Okay. So level 1 and level 2. So first we will come by one. Okay. 22 modifier. Increased procedural service. Okay. For example, one procedure is there. So patient had previous surgery. Patient is performing another surgery on the abdomen. Okay. Due to patient's previous surgery, patient has extensive adhesions in the abdomen. Okay. During the current encounter, due to those extensive adhesions, patient spent more time as well as more effort in order to complete the current encounter procedure. So that time you will use increased procedural service 22 modifier. Okay. So you will not use this modifier to E&M code. Okay. So what are your keywords here? Physician must and should needs to mention in the document. So physician needs to mention. So because of adhesions, increased intensity. So because of adhesions, I took extra time. Because of adhesions, technically it is very difficult procedure, or because of patient severity. For example, patient is obese. Okay. So obese patients are having adhesions extensively. So in order to treat obese patient will took extra amount of time or effort. Okay. So that time you will use this 22 modifier. Okay. You will not use 22 modifier for E&M services. Next, this is not needed for us. 24. This is for not needed, but we need to understand. Okay. If the same physician provides multiple E&M service, so E&M service on the post-operative period. Okay. So for this we need to understand global period. We will do soon. Anyway, in live coding you will not use this code. You will not use 24. Okay. In surgery especially. In 25, this everyone knows. Significant separately identifiable evaluation management service by the same physician or other qualified QHP on the same day of the procedure or service. Okay. Mostly we will use 25 modifier for 0-day or 10-day global period procedures. If the physician performs separately identifiable E&M service. In same day surgery we will not use, but your interviews this is very important. So just here what is important? You will use 25 modifier if the physician performs 0-day or 10-day global period procedure. That we will learn soon. If the physician performs 90-day global period procedure, you need to use which modifier, guys? Any idea?
7 modifier.
57. Yeah, correct. So you need to use 57. Just remember this. If you go to interview, they may ask you what is the difference between 25 and 57. So 25 is for 0-day and 10-day global period procedure. 57 is for 90-day global period procedure. Okay. Next, 26, professional component. So this is for physician modifier basically. Okay. For example, we have an outpatient hospital. Okay. They have the missionary, but they don't have the physician. So they will call physician from outside. Okay. So outside physician will come to the hospital and he will use the hospital's equipment in order to perform the procedure. So that time physician will use 26 modifier for professional component. So he will perform the procedure as well as he will analyze the report. For his service he will use 26 modifier. Hospital will use TC modifier, technical component. Why means here technical component means here just directly they are asking who is the owner of this machinery. So who is the owner, guys, here? Physician or hospital?
Hospital.
Perfect. So hospital will use TC modifier. So physician will use 26 modifier. Hospital will use TC modifier. Those are very, very important. If you go to interview, they may ask you what is the difference between 26 and the TC modifier. Okay. Next, mandated services. So these are not needed. 33 is also not needed. Yeah, 33 is also needed. Preventive services. During the colonoscopy, we will use 33 modifier. Okay. So for example, patient is came in for screening colonoscopy. Okay. So screening means patient does not have any complaints, but he wants to ensure whether he has colon cancer or not. Okay. Whenever you code screening colonoscopy, you need to check patient's payer, whether Medicare or non-Medicare. Okay. So patient came in. So patient is a Medicare patient. Okay. Physician has performed the colonoscopy. So during the colonoscopy, patient did not find any abnormality. Okay. So that time you will use PT modifier. As patient is Medicare patient, you need to use PT modifier. Okay. For example, second patient, he is a non-Medicare patient. Here also physician has performed the colonoscopy. So here also physician did not find any abnormality or colon cancer. So that time you will use 33 modifier. Okay. So what is important here? Whenever you code for screening colonoscopy, what is important, guys? What do you need to check first for screening?
Payer.
Yeah, perfect.
Medicare or non-Medicare?
Yeah, Medicare or non-Medicare. So which modifier you will be used for non-Medicare?
33.
Perfect. Medicare?
PT modifier.
Yeah, perfect. Yeah, these are very, very important for your interviews. Okay, if you have that time, just you
For
can.
Medicare, what will you use?
Sorry,
For Medicare, what modifier will you use?
PT.
PT.
Yeah, PT.
Okay.
Non-Medicare or commercial, we will use 33 modifier. So this is basically based on CPT guidelines. But in the live coding, so based on your payer, they will ask you to code PT for whether it is Medicare or non-Medicare. So based on your client, you need to use these 33 and PT. But for your interviews, you need to follow these guidelines only. If they ask you what is the difference between 33 and PT modifier, so just you need to tell them. So if the patient came in for screening colonoscopy and if the patient does not find any abnormality or colon cancer, if it is non-Medicare or commercial, we need to use 33 modifier. If the patient is Medicare, we need to use PT modifier. Simple. Okay. So you don't need to worry. I will provide this video. You can watch it again. Okay. So anesthesia by surgeon. This is not needed for us. Next, we have bilateral procedure. Okay. So we will use bilateral procedure 50 modifier when the patient performs identical procedures on the both sides of the body during the same operative session. Okay. By appending the 50 modifier, we will request the payer to provide increased reimbursement. Okay. So if the patient performs procedure on both sides of the body, you need to use a 50 modifier. Okay. So here one guideline. For example, we have few CPT codes which are having bilateral in their code description. That time you don't need to use 50 modifier. Why means that CPT code is already having unilateral or bilateral in their code description. You don't need to use any 50 modifier if the code description is having bilateral in their code description. Anyway, no need to worry, we will see soon. Okay. Whenever you want to append 50 modifier, you need to check the operative report. So it must need to provide physician has provided or performed both procedures on both sides of body. Okay. Physician needs to mention each anatomical site. And also you need to check for documentation for medical necessity. For example, here also same scenario. Physician has performed the bilateral knee replacement. So your diagnosis will be osteoarthritis, bilateral knee. Okay. If your diagnosis is bilateral knee osteoarthritis, but if you append only LT or RT modifier, it is a medical necessity failure. Okay. So always ensure your diagnosis as well as procedures are having the same modifier. If it is LT, you need to append LT to CPT. If it is RT or right side, you need to append RT to CPT code. If it is your diagnosis is bilateral, you need to append 50 modifier to your CPT code based on the documentation. Okay. So you will not use this modifier to add on codes. Okay. So we will not use 50 modifier to add on codes. Based on your client, you need to use two codes like RT and LT. We will see soon during our training. Okay. Next, 51 modifier. Okay. So basically 51 modifier is physician modifier. So we will not use 51 modifier in facility setting. Okay. If the patient performs multiple procedure during the same session by the same physician or provider, that time we will use 51 modifier. Okay. So when do you use this one? If the patient performs multiple surgical procedure during the same session, we need to use this 51 modifier to the secondary procedure, not the primary procedure. So how do you identify primary or secondary? Based on RVU. So we will check that soon. How to check the RVU value. I will show you, no need to worry. So lesser RVU CPT, you need to append 51 modifier. Okay. Mostly you will use 51 modifier in specialty coding like GI coding, orthopedic coding, like physician modifier basically. 51 is physician modifier, we will not use in the facility. But in India we have mostly facility coding only in the surgery. We don't have physician coding. Okay. 99% we have facility coding in India. In US we have physician coding. Okay. So facility coding means you will code 10,000 to 60,000 series. In the physician coding, you will not code 10 to 60,000 series based on the specialty. For example, if you work for dermatology physician, that time you can use 51 modifier. If you work for orthopedics, you can use 51 modifier. So that time you will not code all these 10,000 to 60,000 series. If it is dermatology, you will code only 10,000. So that time you can use 51 modifier. Okay. So you will not use 51 modifier on the lesser value procedure or primary procedure. Okay. You can't use this 51 modifier along with primary procedure, which will provide highest RVU. So RVU means here relative value unit. We will see soon. Okay. So for example, we will see one example. So here, so you are coding for, first we will see physician and facility. First we will see physician. For example, you are a GI coder. So you will not code any codes. Only you will code GI coding. Okay. So physician has performed colon biopsy in the ascending colon, polypectomy on the descending colon. Okay. So here biopsy is the lesser value procedure. So here for polyp removal you will use 45385. For biopsy you need to use 45380 51 modifier. Why means you are coding for physician. Okay. Same scenario in the facility. So that time you need to use 59 modifier. Okay. Got the difference, guys? 51 versus 59. Any doubt? Got the guys? Difference? 59 is for facility coding.
That is why I couldn't understand. Can you repeat once again?
Physician means you will code for only one specialty. Okay. Facility means you will code for multiple specialties. Simple way. Got it now?
Yes.
So whatever you told is correct only. Multiple procedures. But these modifiers differs for physician versus facility. Whatever you told is correct. Multiple procedure on the same day by the same physician. Correct. That is 100% correct. But the matter is where you are coding. So whether you are coding for physician or whether you are coding for facility. That is the difference. Right,
Yes,
Gopi?
Vincent, now got it.
Yeah, yeah.
Got it.
Yeah, got it.
So whatever you told is correct only. 59, 51 both are multiple procedure during the same session. Okay, it is based on the payer, whether you are coding for physician or this one, facility. Okay,
Yeah.
when it is matter, same location, you will not code same location multiple procedures. For example, patient has the bone fracture. In order to go or reach the fractured bone, patient will incise the tissue and remove the soft tissue. Those you will not code. So these are all included in the fracture repair. Okay. So here also same. So just remember 51 is for specialty coding or physician coding and 59 is for facility coding. Okay. So you can't use 59 in the physician coding. That's why in ambulatory surgery we will not use 51 modifier mostly. That is for physician coding. So you can use if you code for only one specialty. So that is the difference. Okay. Next we have reduced services. So which is opposite of which modifier, guys? 52 is opposite of which modifier? Yeah, increased. So 22 modifier. So 22 is for increased procedural service. 52 is for reduced procedural service. Simple. Okay. So physician has started the procedure but not completed too. But not completed fully. Okay. So that time you can append 52 modifier. Okay. For example, patient is obese. So again patient started the procedure, but because of patient's obesity, patient is unable to do the this procedure. So that time you can append 52 modifier. Okay. For example, we have, so patient wants to perform colonoscopy. Okay. So during that time, patient has inserted the colonoscope in the anus and advanced until sigmoid colon. The standard colonoscopy is starting point is anus and ending point is ileocecal valve. Okay. But due to patient's anatomy or stenosis, physician is unable to insert colonoscope until ileocecal valve. He reached only sigmoid colon. So that time you can append 52 modifier. Okay. So what is important here? If the patient does not complete the procedure fully, you need to append 52 modifier. So that is the CPT guideline. Okay. Sometime based on your client, for example, your code description is having bilateral in this in the code description, but if the physician will perform only one side, so that time you can append 52 modifier based on your client requirement. Okay. So that is the guideline here. So again this 52 modifier is also for physician coding. Okay. For facility coding we will use 73 and 74 modifier. Okay. So that is the difference. Next we have 53 modifier, discontinued procedure. Okay. So physician has started the procedure, but due to patient's health issues or patient's risk, physician has stopped the procedure, means discontinued the procedure. So that time you will use 53 modifier. Simple. 52 is reduced service. Okay. So physician has started the procedure, but he did not complete it fully. So that time you will use 52 modifier. In the discontinued procedure, physician will start the procedure and he will stop the procedure. He will not do anything. So that time you will use 53 modifier. Okay. So for example, so physician has started laparoscopic cholecystectomy. Okay. So due to patient's condition, like because of anesthesia, patient had hypotension. Okay. So because of patient's risk or patient's hypotension, physician has stopped the procedure or discontinued the procedure. So that time you will use 53 modifier. Okay. So that is the difference between 52 and 53. So 52 and 53 are for physician coding, not for facility. In the same scenario, for facility we will use 73 and 74 modifiers, which we will see soon. Okay. Next we have 54 modifier. Okay. So if the physician provides only surgical care, only surgery, he will not provide any post-operative care or any pre-operative care. He will perform only surgery. So that time you will use this one. Okay. That time you will use 54 modifier. So same way 55, post-operative management only. Okay. Here also one physician perform the procedure, one physician perform the post-operative management. So that time 55. Anyway, you no need to worry, we will not use this live coding. 56, pre-operative management. So pre-operative means before the surgery. Here also same. One physician performs the pre-operative management, one physician performs the surgery, one physician performs the post-operative management. Based on your documentation, if the physician perform pre-operative management, so that time you will use 56 modifier. Next we have 57 modifier, decision for surgery. Okay. So this modifier you will use along with E&M code. So previously we have learned, correct? So which modifier you will use for 0-day and 10-day global period, guys? For E&M, along with E&M?
25 modifier.
25 modifier, correct? So here 57, which you will use for how many global days? 90-day global period. So 57 you will use 90-day global period procedure. One most important requirement here is you need to append 25, 24 or 57 along with E&M code. Okay. Not with the CPT code. Okay. So that is very, very important. You need to use this code along with E&M, not with this one. So for example, patient came into ED with abdominal pain. So after the evaluation, physician has identified patient had acute appendicitis. So patient told the patient that, so you have acute appendicitis, I need to perform the surgery as soon as possible today. Okay. So that time physician will perform emergency appendectomy during the same encounter. So that time appendectomy CPT code is 44970, and along with that, if it is outpatient or inpatient, mostly it is outpatient. So along with your ED, correct? So ED encounter this one, along with 99284 or 285, you need to append this 57 modifier. Okay. So Gokila, what do you use for surgery in the ED? 90-day global period procedure. Which modifier? Like 84 or 85? 99284 or 99285?
285.
Yeah, 285. Correct? So along with 99285, you need to use this code. Okay. So that is the guideline here. Okay. Great. So next, so that is about 57 modifier. Next we have 50.
Vincent, can you repeat 54 modifier?
54 is physician provides only surgery. He will not do any pre-operative management and post-operative management. He will perform only surgery. That's why they have mentioned surgical care only. Okay. So that time you will use 50
Okay.
code. Yeah, you no need to worry. Just I will provide the videos. You can watch once again. So next we have 58 modifier. Okay. So this is also one important modifiers. Okay. Basically 58 modifier is for staged procedure. Okay. So staged or related procedure service by the same physician or the qualified QSP during the post-operative period. Okay. For example, physician wants to perform breast reconstruction. Okay. In the initial procedure, physician will perform mastectomy. So physician will remove the breast. In the second visit, physician will perform the breast reconstruction. So that time you will append 58 modifier to the second procedure, not to the first procedure. Why means second procedure is the staged procedure or first procedure, like mastectomy. Okay, so staged or related procedure. So that is the CPT guideline. Okay, so when do you use 58? Planned procedure or staged procedure by the physician before starting the procedure. If the staged procedure is more extensive than the primary or original procedure. Okay. If the physician performs any type of therapy after the surgical procedure, you will append 58 modifier. Okay. Next we have 59 modifier. Yeah, go ahead.
Could you please provide one example for 58 modifier?
I told you na, breast reconstruction. So mastectomy is first encounter. In the second encounter, physician will perform reconstruction.
Okay.
So already told this example.
But I'm asking for one more time.
So no need to worry, I will provide the video. But already I have explained this example. So first encounter, mastectomy. Second encounter, breast reconstruction. For breast reconstruction, you need to use 58 modifier.
So Vincent, the breast reconstruction part will be the stage procedure, right?
Yeah, correct. Yeah. Breast reconstruction is the stage procedure which needs to be decided by the physician before starting the first procedure. Got it? Documentation you need to check whether physician told any keywords like staged or initial procedure. Like that, those are the keywords you need to check in the documentation. Mostly in the facility coding you will not use this one, 58. This is also for physician coding, not for facility coding. Okay. Next 59 modifier, which is very important for facility coding. So basically distinct procedural service. How do you identify? If the patient performs multiple incisions, if the patient performs procedures on multiple anatomical structures, okay. If the patient performs multiple procedures on multiple areas, okay. So that time we will use 59 modifier. Okay. So in 59 modifier we have 4 variants. Okay. XE, XU, XP and XS. XE means separate encounter. So if the patient performs 2 encounters on the same day, morning 1 encounter and evening 1 encounter, so that time you will use XE modifier, means separate encounter or separate services. Okay. So for example, so patient was seen in the office for abdominal pain in the morning. Okay. So patient was seen by the physician in the morning for abdominal pain. In the evening, same patient came into the ED for injury. Okay. So here you will append XE modifier. XE means separate encounter on the second service. which is acute injury. So morning session is for abdominal pain, evening session is for injury. So for injury you need to append XC modifier. Okay. Next we have XS modifier. This is very important for ambulatory surgery coders. Separate structures basically. Okay. For example, patient has performed one procedure on the arm, one procedure on the leg. Why means these are two separate structures, correct? So that time you will use XS modifier. Okay. For example, patient had injury. So patient had fracture in the arm as well as fracture in the leg. So during the same encounter, patient will perform two procedure or multiple procedure on the arm as well as the leg. So that time you need to use 59 modifier or XS modifier based on your client. Okay. So next, XP modifier, separate practitioner, same day. For example, patient had like fracture. So orthopedist perform the fracture repair. On the same day, patient had nerve repair also. So neurologist will perform the nerve repair. Okay. So that time you will use 59 modifier to any code. Why mean? Separate practitioner or separate physician. Here you will use XP modifier. Okay. So next we have XU modifier. So XU means unusual non-overlapping services. So these are very important for your interviews. You need to watch this video once again at home. Okay. XU modifier is for unusual non-overlapping services. Okay. So for example, we will see one example here. Okay. For example, we have one CPT code. So which is having the imaging guidance. Okay. But patient has performed another procedure also, where imaging guidance is inbuilt in the CPT code description. Okay. On the second procedure, patient needs to use the imaging guidance, but on the second procedure, imaging guidance is already included. So that time you can append XU modifier. So stating that I have coded here imaging guidance as second procedure imaging guidance is not at all related to first procedure imaging guidance. Okay. So that is the example. So any doubt guys, clear? 59 modifier is very important for your interviews. Okay. Next we have 62 modifier. So during the same session, if multiple physicians from same specialty perform the procedure, 62 you need to append here. When two surgeons work together as primary surgeons performing distinct part of a procedure, that time you need to use 62. Here your keyword is primary, not assistant surgeon. So both needs to work as a primary surgeon. 62 modifier. Okay. So if the patient performs procedure on the infant less than 4 kg, 63. Anyway, we will not use this one in the live coding. 66 also we will not use. Okay. 76 also we will not use. So what is this one? Repeat procedure or service by same physician or other qualified QHB. Okay. So most of the time this modifier we will use in which setting guys? I think Sandeep know about this modifier.
ED.
Yeah, ED and
Same
radiology
procedure,
also.
right?
Radiology also. So sometimes physician will
Yeah,
perform
radiology also. Yes,
yeah,
yes.
multiple X-rays, correct? So that time you need to use this one, but in the same day surgery we will not use this one. Okay. 77 modifier. Repeat procedure by another physician or other QHP. So same procedure. Okay. The same procedure performed by multiple physicians. You need to use 77. This also we will not use in the ambulatory surgery. Okay. 78. Unplanned return to the operating procedure or room by the CMP or other QHP during the post-operative period. Okay. For example, patient undergone 90-day global period procedure. So 90-day global period means how many months, guys?
3 months.
Yeah, 3 months. Correct. So after 2 months, patient had some problem. So again patient came into the surgery. That time we will use 78 modifier. So for example, patient had appendectomy like previous 2 months back. So after 2 months, patient had bleeding. Because of that bleeding, physician took patient into the OR room for hemorrhage control within the global period. Means as its appendectomy is a major procedure, its global period is 90 days. So that time here we will use 78 modifier. Okay. So stating that, so patient is in the global period of appendectomy. So I have used 78 modifier. Okay. So here related procedure. So 79 is for unrelated procedure. So for example, patient had appendectomy 2 months back. So global period means 90 days means 30 days. Sorry, 90 days, correct? So after 60 days, patient had fracture. Okay. So appendectomy is different service and fracture is different. So that time you need to append 79 modifier. Okay. So just you are telling that. So we took patient into the operating room for the major surgery which is not related to the primary surgery. So can you mute, guys? So that is the 78 and 79. Okay. Next to 80, assistant surgeon. So which modifier you will use, guys? If it is primary surgeon, anyone? 80 modifier is for assistant surgeon. If it is primary surgeon, which modifier you will use?
62.
We have discussed, correct?
Yes, it is 62.
Perfect. Yeah, 62 modifier. Perfect answer. Okay. So if you go to interview, they may ask you, what is the difference between 62 and 80? So that time you need to tell. If the procedure is performed by two physicians as a primary surgeon, that time you need to use 62 modifier for both physicians. But 80 modifier is for assistant surgeon. So that is the guideline. Okay. So these are not necessary basically. Minimum assistant surgeon, this is not needed. 82 assistant surgeon when qualified resident surgeon not available. So we will not use this one. In the interview also they will not ask these ones. 90 is not needed. 91 is not needed. 92 not needed. 93 is not needed. So these are 95 is not needed. Okay. Rehabilitative services. Rehabilitative services. 99. Okay. In the live coding we will not use 99 modifier, but so based on your client requirement. Okay. So you need to use this modifier. Okay. Multiple modifier 99. So these are not needed. Okay. So next we have few important modifiers, these ones. 74 and 73 and 74. These are very important for ambulatory surgery coders. Very important. Okay. So previously we have learned 52 and 53 modifiers. Remember or not? So what is 52 modifier, guys?
For reduced services.
53 modifier?
For discontinued procedure.
Yeah, perfect. Those modifiers you will use only for physician coding. Okay. These modifiers 73 and 74 you need to use for facility coding in the same situation. So we'll see 73 modifier. First, this is very important. Discontinued outpatient hospital or ambulatory surgery center procedure prior to the administration of anesthesia. Okay. So for example, physician wants to perform the appendectomy. Okay. Physician took patient into the ward. Okay. Because of the procedure, patient is very depressed and patient is having anxiety. Our patient's heart rate is very fast. So that time physician will cancel the procedure. This is facility coding, remember. So that time we will use 73 modifier. So here physician did not administer any anesthesia. Before the anesthesia, if the physician cancels the procedure, 73 modifier. In the second scenario, physician took patient into the operating room. Okay. So anesthesia physician provided the anesthesia. Because of that anesthesia, patient had hypertension. Okay. So that time you will use 74 modifier. Along with your CPT code, whatever physician wants to perform. For example, appendectomy if you take. Okay. Before the anesthesia, 44970. Which modifier guys? 73 or 74? Before the anesthesia. So before the anesthesia, you need to use 73 modifier. Okay. So after the anesthesia, which modifier you will use? Anyone?
Now only I am hearing your voice.
Sorry?
Now only I am able to hear your voice. So past 2-3 minutes I couldn't able to hear your voice.
Problem from your side only. But everyone can hear. Correct or not, guys? Sandeep, can you hear me from first?
Yes, sir, I can hear.
Yeah. So adjust your settings.
Okay, I'll check.
Yeah, no problem. You will get everything in the video. Okay.
Okay.
So whenever you want to code, and third scenario. These are very important for interviews. These are the regular scenarios you will encounter. For example, patient came in for appendectomy. Okay. So patient is in the post-operative area or PACU. Sorry, pre-operative area before the procedure. Okay. So before going into the operating room, patient had like hypertension. So here physician wants to perform appendectomy, but before going to the operating room, patient had hypertension. So physician will stop the procedure. He will not perform any procedure. So that time you don't need to use CPT code. Just you will use reason for the procedure as well as Z538 or G538. Okay, simple. What is important here? If the physician does not take patient into the operating room, you can't code CPT. If the physician takes patient into the operating room, then you have two options. You need to check the documentation whether physician has administered the anesthesia or not. If it is before anesthesia, physician has stopped the procedure, 73 modifier. If it is after the anesthesia, you need to use 59 mod. Sorry, this one. What is that? 74 modifier. So before anesthesia 73, after anesthesia 74. Simple. Okay. So these are the information related to, and we have these level 2 modifier, HCPCS National, which are maintained by CMS. So I upper left eyelid, E for eyes, F for finger. Okay. So T for toes. Okay. These we will not use basically. So eyes, fingers, toes, and these laterality modifiers, RT and LT. So these are very, very important for our live coding. So but here you need to understand how to calculate modifier. So anyone knows, guys? How do you remember modifiers? Finger and toe modifiers on the eyes. Anyone knows?
Yeah, from thumb it will start, right?
Yeah.
So from
Left
thumb
side.
to the little finger, yes.
Yeah. Thumb to the little finger, correct. You need to start from left side, not from the right side. Okay. For example, open your thumb, like left hand. Your thumb is, for example, you are coding for fingers. Your thumb is finger. Okay. Your index finger is F1. Your middle finger F2. Your ring finger F3. Your small finger or pinky finger F4 on the left side. Okay. And your right side thumb is which modifier, guys?
Fine.
Which modifier? F5. Perfect. Next, index finger F6. Middle finger F7. Ring finger F8. And right side little finger. Which modifier? F9. Simple. So we don't have F10. Starts from FA and ends with F9. So now tell me, left side, how do you code if it is right side middle finger? Which modifier you will use? Right side middle finger.
Yeah, it's the F7, right? That's right hand. Third
Yeah.
digit.
So now tell me the same thing for toe. Right side middle finger. So same criteria you need to follow. Instead of F, you need to
Yes,
use T.
yes, yes. T7, right? Right foot,
Perfect.
third digit.
Yeah,
Yes.
yeah, correct. So T7. Here only they have mentioned, correct. So T7. So these are the HICPIX modifier which will be maintained by CMS. Okay. 0-day global period. How many days are included? How many days, guys?
Only procedure day.
Perfect.
Yes.
Only procedure day. Okay. So what about this one? If the procedure is 10-day global period, how many days are included?
During surgery day, 11 days.
Perfect. 11 days.
Yes.
Surgery day plus post-op 10 days. Total 11 days. What about major surgery? Like 90-day global period.
That's 92 days, right? 2 days.
Yeah,
22 days.
perfect. 92 days. Okay. So that is the most important concept you need to remember. Okay. Next, we will see one example for. So what is XC modifier? What is XC modifier?
Separate
Separate
procedure, right?
encounters for separate procedures.
Yeah. Multiple encounters on the same day. During the separate encounter. Okay. Same day separate encounter. Morning one encounter, evening one encounter. XC. XP. What is XP? Separate
X
physician.
separate
Same day separate physician. What is XS?
access for different structure, anatomy.
Perfect. Yeah. Separate organ, structure or incision. What is XU?
XU, you have given the example of that imagine, like one procedure, the imagine is included, and again the provider performs the procedure with the help of image guidance. So both are distinct, different from the each other. So we need to append the XU modifier in that case.
Correct. Okay. For XU, we will see one more example. Okay. For example, patient has perform laparoscopy procedure on the liver, and also ultrasound guidance procedure on the liver. Same day. Okay. So that time we will append this XU modifier. So we are stating that this laparoscopic procedure and ultrasonic procedures are different or unrelated. Okay. So that time we will give this procedure, this XU modifier. But what is important here is, even though if the patient performs multiple structures, you need to append these modifier based on your client. So some pairs will ask you to use 59 modifier only. Instead of these sub modifiers are 59, like XE, XP, XC, XU. You need to append only 59. If your client will ask you to use XS modifier, that time you need to use XS modifier. But for your interviews, you need to remember XE, separate encounter on the same day, XP, different physicians on the same day or separate physicians. Okay. Or X, separate structures are on the same day or same encounter. XU, or non-overlapping services on the same day. Okay. So, and one more important modifier is KX modifier. Okay. For example, patient is undergoing physical therapy. Okay. Based on the CMS guidelines, patient needs to perform only 10 services. But based on patient's condition, patient need one more service. So that time you need to use KX modifier. Okay. So what is the definition? So we'll use KX modifier when the patient service exceeded the Medicare policy of 10 encounters or 10 threshold. Okay. That is KX modifier. Next, one more important thing is, when to use KX modifier in the colonoscopy, which is very, very important for your interviews. Okay. So you need to use KX modifier along with G0105 and G0121. If the patient performs screening colonoscopy due to positive result from the non-invasive stool-based tests. Okay. Like FOBT, DNA, or whatever it is. Because of diagnostic test, if the patient performs screening colonoscopy, during the screening colonoscopy, if the patient does not identify any abnormality for Medicare patients, you need to use KX modifier only for Medicare patients, not for commercial patients. That time you will use G0105 high risk, G0121 low risk. Okay. So no need to worry, we will see once again during our 40,000 series discussion. Okay. So that time you will use KX modifier. Okay. Next, one more important concept we need to know is NCCI edits. If you go to interview, they will ask you, what are NCCI edits? What are NCCI edits, guys? Anyone knows?
That's correct coding initiative.
Corrective
National
initiative.
correct coding. Yes.
Perfect. National correct coding initiatives. Okay. Which will prevent the inappropriate payment. Okay. So using these NCCI edit, you will prevent the inappropriate payment. Okay. So we have three types of NCCI edits. One is procedure to procedure edit. Usually we will call it as PTP edits. First one. Second one, medically unlikely edits or MUE edits. You no need to worry, we will see the example. Okay. Next one, add-on edits. Usually we'll call it as AOC edits. So total how many edits, guys? How many indicators here? How many indicators?
3.
3 types of indicators are edits. PTP edits, procedure to procedure edits, means they will stop the multiple procedures. I will show you example during the live session. Okay. Next we have medically unlikely edits. Usually we will call it as MUE edits. Next we have add-on code edits, AOC edits. These are very, very important. You need to remember, must and should. While watching the video, write down all these important things. Okay. Take your notebook and write all these important concepts in your notes so that you can remember. Okay. So PTP edits, MUE edits, as well as add-on code edits. Okay. So here we have 3 types of NCCI indicators. Okay. If the NCCI indicator is 0, you can't append any modifier. Mostly these NCCI indicators are used for 59 modifier. You don't need to worry. In the practical, I will show you during the live session. 0 means you can't append 59 modifier. Okay. 1 means you can append the 59 modifier. 9 means this indicator is not applicable to append 59 modifier. Okay. So if you go to interview, they will ask you what are the NCCI indicators. So total how many indicators, guys?
Yeah, 3, right?
Yeah. What are those?
PTP, MUE, and add-on code. 3 edits, right?
No, those are PTP types.
Okay, sorry.
Sorry.
0,
Those
1,
are
and 9.
NCCI edits. Edits are different, indicators are different. Okay. So PTP type 3 types of edits. Procedure to procedure edit, PTP edits, medically unlikely edits, MUE edits, add-on code edits, AOC edits. Those are edits. So 3 types of edits. NCCI indicators are 3 types. 0 indicator. You can't bypass 2 codes using the 59 modifier. If the NCCI indicator is 1, you don't need to worry. I will show you practically during our live session. Okay. And 1 is for, so basically they are telling if the indicator is 1, you can append 59 modifier. If it is 9, so this concept is not applicable to that code basically. So you can append or you can code multiple procedure. Okay. So we will see during the live coding. Next one is unbundling. Okay. So what is bundling here? Single CPT code to display separate procedure. Okay. So for example, patient has performed the surgical procedure. Okay. And in order to start the surgery, patient has started the incision. Okay. So here you can't code incision separately, as incision is already bundled into surgical procedure. So that is the bundling. Next we have unbundling. Okay. Such as, for example, patient wants to perform colectomy. What is colectomy, guys?
So
What
removal of
Yeah.
colon.
Colon.
Yeah, perfect. So before doing the colectomy, patient will examine the abdomen. Okay. Usually in the technical word you will call it as exploration. Okay. So during the abdominal procedure or during the colectomy, you can't code exploratory laparotomy. Okay. If you code exploratory laparotomy, it will become unbundling. So you are coding separately. Okay. So that is unbundling. Next, you need to understand down coding. So what is down coding, guys? Anyone knows?
Yeah, I mean we are down coding the procedure if the criteria is not met. Like I know for X-rays that number of views
Yeah.
are not. Yeah. So
Yeah,
we are.
perfect. Yeah. In the surgical world, for example, patient has performed colon polyp resection using the snare technique. But you can't code colon biopsy. So which is down coding. Originally patient has performed the polypectomy, but you have coded the biopsy. So that is down coding. Means you are coding less than the procedure performed by the physician. So that you will call it as down coding. Next one is up coding. This is opposite of this. For example, physician has performed the biopsy. You can't code here polypectomy. So that is the up coding. Okay. So down coding means coding lesser value or using lesser value CPT code. Up coding means using higher value CPT code if the patient performs lesser value procedure. So those are the very important definitions you need to remember for your interviews. Okay. So